Good morning, my name is Jules Miazza. I am a medical student at the University of Basel, and I am also working at the University Hospital of Basel in the Department for Cardiac Surgery. I have been working on hemorrhadsorption for patients with infective endocarditis that are undergoing cardiac surgery. Since 2010, we've had 249 patients with infective endocarditis undergoing cardiac surgery at our institution, and since 2016, we've been using hemorrhadsorption to treat those patients in addition to surgery. If you are not familiar with the concept of hemorrhadsorption, in Basel we use the Cytosorb hemorrhadsorption system, and an easy way to describe it is to say that it is a small cylinder. It's about the size of a can of soda, and it is filled with small beads, and those small beads, they have even smaller pores in them. And what we do is that we connect this small cylinder in the cardiopulmonary bypass machine, the heart-lung machine, and during the operation the blood will flow through the cylinder, and the idea is to remove cytokines from patients' blood. And in doing that, we hope to reduce inflammation and in turn to reduce postoperative complications. So we wanted to create two comparable groups, and to do that we used inverse probability of treatment weighting, and we did that on the basis of Euroscore 2, age of the patient, and other factors that you can read on the top left on your screen. After doing that, we obtained two groups, one hemorrhadsorption group with 36 patients and one control group with 171 patients. And we analyzed those two groups for various endpoints. First of all, the in-hospital mortality, then the length of ICU stay and the total length of hospital stay, and also for the postoperative complications. And if we now look at our results that are summarized on the table bottom left on your screen, we saw no difference between the two groups in terms of in-hospital mortality, also no difference in terms of length of ICU stay and total length of hospital stay. But we saw that we had more reoperations for bleeding in the hemorrhadsorption group. So in conclusion, we conducted this retrospective monocentric study that showed no difference between the hemorrhadsorption group and the control group, except for a tendency or for more reoperations for bleeding in the hemorrhadsorption group. In conclusion, we can say that we need some prospective study to evaluate the role of hemorrhadsorption in cardiac surgery. I thank you very much for your attention, and I look forward to meet you next year at the Congress. Thank you very much.